तेनू रखा तो छुपा के रखा अखा ते सजा के तुम्हें मेरी वफा रख अपना बना के मैं तेरे लिया यारा ना पावी कदे दूरियां तेनू रखा तो छुपा के रखा अखा ते सजा के तुम्हें मेरी वफा रख अपना बना के मैं तेरे लिया यारा ना पावी कदे दूरियां मैं जीना हर
Okay, love the song, but
I mean, every time you hear it, it's just good.
yeah, and then sometimes they flag it, so I don't want that to happen. But anyway, good morning, Dr. Room. How are you? It's been a while, couple of weeks.
I'm good.
You were busy changing your change your position and area, different area, a different job, at different timings you were there. But it's so nice to see you today.
Yeah, thank you for having me.
We're going to have it after every same schedule every 4 weeks again. So I want to say welcome everyone. Namaste, Sat Sri Akal, Salam Alaikum, and Jai Shri Krishna to everyone. And of course, very nice good morning. That is there. And I'm trying to see all my friends on my phone. So welcome everyone who's here right now. Let me see who's there at the moment. So we have Dr. Arum here with me, Jamil. Dr. Arum Jamil. She's going to be, I think we did touch the subject one time regarding diabetes, but that was a couple of months back or maybe about a year ago. So we thought that it's about time we touch the subject again because it's a very important subject. And, you know, so Arumji, humko batayenge how to see the symptoms that were very hidden. We don't know what are the symptoms. And good morning, friends. So the symptoms they creep up on you without you realizing it. And I think we should get an idea what they are before they become a full-blown diabetes case. So if we try to protect ourselves or do something beforehand, when the symptoms come in, we might save ourselves a lot of aggravation or whatever, problem later on.
Yeah.
People,
prevent.
Exactly. They're very thirsty or they go to the bathroom a lot. I think those are a couple of the symptoms.
Correct. Yes. Yeah.
That's a big one because my mother used to, she never said anything is wrong. She said, no, I have to go. But then finally, when we took her, it was like a full-blown case. And she didn't want to go to the doctors, and they don't want to go. The older people, they don't like to go to the doctors. Back home, they try to avoid going as much as they can.
Correct. Yes.
They need to go, So yeah, that's what happened. Good morning, Ji. Good morning, Surjit Ji. Watching, she's from India. Good morning, Asha Ji, Rama Ji, Kamlesh Ji. They're all over here today. Like I said, the subject is diabetes. So if you have any questions or anything to ask, please do so right here. And I will ask Dr. Arun, right? She'll answer the questions. So abhi thoda aap bataएं, like let us know like a little bit about some of the symptoms or signs that we should be aware of,
Right. So yes, Veena ji, thank you for having me. And of course, couple of very common signs and symptoms you already have mentioned. First is, the frequent urination. The high blood sugar, of course, it's something that the body tries to manage target of blood sugar inside your body in the blood levels. So extra sugar has to come out of your body. So the body tries to get rid of it to keep a balance of the blood sugar. So what happens is high blood sugar we call it as a diuretic, meaning it just goes out of the system. When sometimes you use water pill, so the sugar in the blood is like it's like a water pill. It just removes, it comes out of the body, but it takes out water out of your body too.
Oh, that is why you're thirsty.
That's why, yes, you have frequent urination, meaning you try to get rid of the blood sugar, plus your it draws the fluid or the water out of your system. So you get dehydrated, and then you try to drink a lot of water. So it's more thirst, you just feel thirsty. So those are a couple of the symptoms. Then again, we know that you feel hungry all the time. Even if you eat it, you just want to have snacks in between your meals. So that is one of the things. High blood sugar, then you can have blurry vision. Yeah, yes, and brain fog. There can be some problems with memory. So of course, we know that there are many things which can um, where you have symptoms like this, like high blood sugar, but these are like very common signs and symptoms where you need to check your blood sugar or go to the doctor and things like that. Then a couple of the things that you just, with the mood, you just get very irritated. And then you may have fatigue. Of course, you just feel very tired all the time. That is one of the sign, and you can feel. Then there are few signs or symptoms you can have with goes on the skin. So sometimes you have noticed people who can have, like a dark skin, usually on the folds, like on the neck, around the neck, there can be a little bit dark, black, velvety, like discoloration around the neck. Sometimes, underarms or just the
Yeah,
skin.
I've seen it on some people, but is it because of the diabetes?
Yeah, it can. Yes.
Oh,
Yeah, so that's very common with the diabetes. It's called acanthosis nigricans. Of course, there are other conditions, and it can happen sometimes. Some kind of cancer also, but diabetes it's common.
I see.
Yeah, and then you can have skin tags. You can have a skin tags, dry skin on your hands. Those are one few things, like on the skin. So that is something you can just, if you notice those kind of, skin changes, then you can, of course, you just have to check your blood sugar and or go to the doctor.
Oh boy. Quite
Yeah.
a few things. Yeah, I didn't know these other things, but the only thing I was aware of the thirst and the urination part, and yeah, I didn't know about the other quite a few things I learned just now actually.
Mhm. Yeah, so skin changes, the skin can have some changes.
And you said the hands are very dry. The skin the skin gets dry.
Yeah, there is a condition when there is dryness on your digits, meaning like hands and fingers. So there are certain condition like when usually you have dryness around your digits, like your fingers. So that is something that it can happen when you have high blood sugar. So these are the things. I mean, of course, diabetes and high blood sugar and insulin resistance, it can cause some of these things before you know that you are diabetic. So yes, so all this condition, that when diabetes happen, of course, when we see your blood sugar, if fasting blood sugar is more than 126 or your A1C is more than 6.5, but before your blood sugar is at this level, it's been like 10, 15 years of insulin resistance, pre-diabetes, high blood sugar before it comes to that point, because your body tries to maintain that much of blood sugar, it tries to get rid of blood sugar. Then there is a whole cascade or whole cycle which happens where high blood sugar, then increased production of insulin to maintain that blood sugar in your body. Then what happens is then eventually your pancreas stopped functioning and not producing insulin anymore, then your body and all the organs, they get just resistant of that insulin, and then when see
See.
diabetes. So it's like a 10, 15 years. And of course, as we talked about the skin, then 10, 15 years of high blood sugar in your body, it of course it damages everything. That's why we see that people can have nerve damage where you have peripheral neuropathy, where you just feel tingling, numbness in your feet or hands, usually in your and then sometimes you cannot just feel anything. It's just all numb. So that's why you see that if there is any skin tear breakdown or anything, it just gets infected because you do not know how to take care of it because you don't feel anything. And it becomes ulcer and infection. And of course, we see a lot of cases where when it's amputated and then
Right.
of course,
I've heard of that. Yes.
Mm.
Yeah, that's sad because even the color on the feet also, the legs. That's
Correct.
different.
Yes. Yeah.
Color
Yeah.
on the
It just
feet.
gets
Yeah, it's dark.
pigment, has dark and
Yes.
pigmentation.
Yeah. So saying that like pre-diabetic stage could be before you reach the full-blown diabetes. So you could be in that stage for 10, 15 years?
Yeah.
Pre-diabetic stage? Before it develops?
High blood sugar. So
Yeah.
pre-diabetes, it's something that when your fasting blood sugar is less than 126 or your hemoglobin A1C is between 5.7 to 6.4. But this is, we know that this is diabetes, then pre-diabetes, and then there is, of course, high blood sugar, which is abnormal. These are the numbers which we have mentioned just to treat and when to start using medicines and things like that. But this has been going on for at least 10, 15 years before you get to this point, because your body tries to compensate and it just comes to a point where it can't, and then that's what happens.
I see.
Yeah.
So that is interesting. So that means for basically when you go for doctors, I mean, when you go for checkup, one should also, even if you don't have any symptom, I mean, if you think you're not diabetic, or even if you are pre-diabetic, you should get yourself checked for all these numbers.
Yeah, because I mean, of course, it's called like a screening. You know that if you are overweight, then you have to have a screening. At certain age, you have to go and screen. Sometimes, if you have family history of diabetes, then you have to. Then sometimes, the women who have babies who are born, like overweight, like more than 9 pounds, they need to be checked for high blood sugar or diabetes and kind of things. So those are the things where you have to screen for diabetes. So we know that we always see that it's a good thing that you are doing. The baby is born healthy, but if baby is overweight or like high pounds, then of course then you have to just check on your blood sugar, because if you are diabetes or high blood sugar, the kids, the babies born are like they are overweight kind of thing.
Yeah, but that doesn't mean that baby will also, he's predisposed. I mean, he or she, will they also get it when they're
yes, yeah, because of course it's connected. If you have high blood sugar, that's why it's very important to have your blood sugar checked, and that's what the gynecologist or OB/GYN they check. And if you are diabetic or high blood sugar, sometimes you can have gestational diabetes.
Right.
It needs to be controlled very, like they have to be under good control, because your baby is exposed to that high blood sugar. So that sometimes can happen that if the baby is exposed to that high blood sugar, when it's born, if the blood sugar can drop suddenly, and then that's why they have to be monitored. And that's why it's very important to have your blood sugar checked and monitored and regulated or treated during pregnancy.
So Ramaji is asking a question here. Does the hemoglobin levels make any kind of difference with sugar levels?
Correct. Yes. Yeah. That's a very good question. So if someone is, because hemoglobin A1C, when we check it, it's the 3-month,
Right.
right,
Average, isn't it?
sugar
Okay.
average. Yeah.
3-month average. Yeah.
And the blood sugar average, which is connected to the hemoglobin part of, the blood cells. So if someone who is anemic, very low hemoglobin, then the blood sugar can be, of course, that can be falsely low, because even because their hemoglobin is low, and then it can affect. Yes.
See.
In that case, then you have to do fasting, blood sugar test, and sometimes, of course, if there is any kind of doubt, then there is glucose intolerance test. Those kind of tests you have to do.
Oh.
Yeah.
To know all these things, because I know that the glucose during the pregnancy, they sometimes you have to do that, because I remember
when it's something like borderline or anything which is very close, then they ask you to do that test.
Thank you. Welcome, Ramaji. Welcome. Any other questions? Please do ask. Thanking you for giving all the information. Diabetes, I think I don't know why I've heard that it's more in the Asian, South Asian community, Indian, Pakistani, unme zyada hai.
What?
It is diabetes.
Zada, of course, they are many, but of course, it's like prevalent, meaning like it's like an epidemic kind of thing. Like in every, there are like millions and millions of people, they are diabetic. It's like a epidemic. And then, as I said, that many are undiagnosed, many are diabetic. Of course, unless you check it, you won't know. So, and it can be just undiagnosed for years, where you can prevent, pre-diabetes to diabetes, or actually reverse it with the things like diet and things like that.
So again, back to the diet, and always diet is good for all kind of problem, high blood pressure, everything. Diet and exercise, go ahead.
And for diabetes, of course, the diet is equivalent, or of course better than the medicine, because the medicine, we use it to delay the progression of diabetes. But if you are doing the diet, then of course it prevents, and sometimes it can reverse the diabetes. It can be reversed with diet. And some of the symptoms, if they have this peripheral neuropathy, it's a very painful kind of situation. If you have tingling, numbness, and painful nerves, then most of the medicine, it doesn't work. Of course, the medicines, it cannot be you cannot treat anything 100%. People can still be very, debilitated because of that pain. The nerve pain is very debilitating. So in that case, even like 2 weeks of diet control, it helps with the peripheral neuropathy. So that is a research that even just 2 weeks, if you're doing whole food, a plant-based diet, then your neuropathy can be improved.
I see.
Yeah. So
I just want to ask you, I've heard a lot of, whenever you talk to a lot of people who are diabetic or pre-diabetic, who are they taking any medication, they always talk about metformin.
Because it's basically the first line of medicine. When you go to a doctor, of course, we have some guidelines and things like that. So, for example, if you go to for high blood pressure, so there are certain medicines. So it's first line medicine, then second, and third, and fourth. So there are some strong medicine you do not want to start, at a first line, because sometimes you may have side effects too. So you just want to start with a lower dose, and which is effective, and then we just add on kind of thing. So metformin, of course, it's a very old drug, and this is something the first line. where you can start with that. And of course, then there are different classes of medicine which you can use for different people, because if you metformin, usually if you are diabetic, sometimes usually they are overweight or obese, so metformin helps with the
What is exactly does metformin do? Because I know each medicine does its own, it tries to lower the sugar in a different way. So metformin, what is exactly does it when you take it? So what is
So
it?
it basically with the digestion and decrease absorption kind of thing. And it has other effects too. As I said, that sometimes it helps with the weight loss also, with the weight control. That's why they usually start metformin first. But again, there are certain conditions where you cannot start. Sometimes if you have kidney disease, and at certain creatinine level or creatinine clearance, sometimes with the kidney disease, you cannot do metformins. And then there are other drugs which you can, because sometimes when you have diabetes, then there are other conditions too, which you have to see. But of course, there are many other medications, like the new medicines with weight loss and things like that. But you usually start with metformin because they're usually very easy, in a sense that not too much of side effects, plus usually very well tolerated kind of thing. I know usually they have.
A lot of people have stomach issues with that too.
Correct. Yes. Yeah. So usually the digestion and sometimes upset stomach, which can, that it can be tolerated after a few weeks. But if it is something that cannot be tolerated, then of course, then you have to just change the medicine.
Yeah. I mean, there are also different types, like, because I had that problem in the beginning, like with the metformin. I was taking it, and then the doctor changed it to, what is it? I think it was Trajanta, and then Jardians. So those are the two. I think those are stronger, I think. Or for weight loss. They're more for weight loss also as well. I think those.
Yes, I mean, of course, they started with the diabetes, for basically diabetes, but of course, it was seen that it decreases the weight, and so that's why, I mean, a little bit on a higher dose than you have.
Yeah,
That's
stronger. Those are stronger than metformin. That Jardians and Trajanta, both of them, and it depends on. And of course, then now they have all this other stuff too, like insulin, and then they have once a week the under the skin, injections like Ozempic.
Yes. Because I mean, of course, most of these oral medicines, usually they decrease A1C about 1.5 to 2, meaning like if you have 8 of A1C, so these oral meds can decrease it to like 7 or 6.5. But sometimes if your blood sugar is that high, then usually the insulin is something that you have to start with the insulin.
I see. So then, so that's the last resort, the injections, or they should be with the medication.
So yes, so for example, like metformin, usually it's if you are trying to lose weight, or because it affects your weight, also sometimes you just continue with the metformin, then you just add insulin if patients are requiring insulin, because it also, you have seen that many patients, they have to use a very high amount, dose of insulin. So then you can do 2 or 3 medicines along with insulin, just to decrease the requirement of insulin and different effects of insulin, because all these medicines, like they are different classes. Like for example, metformin, it decreases the production of glucose, decreases the absorption from your gut, then insulin, it works in another way. Then the new medicines, they work in a different way. So it's just like targeting different parts to try to do that. Yeah. Yeah. Yes.
So how does the, I mean, I'm not sure if you can you explain that to a little bit about this 1 week injection, for example, Ozempic? A lot of people are taking that, or Trulicity. So how does that work every day? Like, you take it once a week.
Mhm.
What is that? How does it keep it level or, under control? Does it work in your system? I mean, it works by itself.
So, for example, this Ozempic, I mean, these are the different class
Yeah,
of
that's what I'm saying. What is that
like
work?
semaglutide. So it's it's a GLP-1, like a glucagon, like peptide. Like it works through a receptor, and it increases the insulin secretion. So you know that when you have diabetes, there as we discussed, that like 10-15 years of working too much, like overwork of the pancreas, then your body just stop producing, or it becomes so resistant to, so that these medicines, they have different way of working. Like it increases the insulin secretion, then and these medicines, they delay the gastric emptying also, meaning that your food is in your stomach longer period of time, so you just feel full, kind of thing.
With which
Longer.
one? The Ozempic?
Yes, semaglutide, yes.
Oh,
So
I see.
this class of medicine. So it's not that it just works one way, because they work through certain receptors and things like that. So they work in different parts of your body, like decrease gastric emptying, then increase the insulin secretion, then it just activates some receptor which are more sensitive to insulin, so decreases the resistance of insulin. So it works different ways to control that.
So in other words, if you're like you're saying, the food remains in your,
Decrease gastric emptying, yes, meaning that, for example, if you just drink milk, it comes out, because every food, of course, it comes out of your stomach on a different time. When you are eating meat, it stays a little bit longer. It needs more kind of work to
Right.
break down, digest, and things like that. Then if something like vegetable, it just comes out quickly. So you just feel full when you have a little bit more complex kind of food, where the body has to, do more work. So if it decreases the gastric emptying, meaning that the food is there in your stomach longer, you just feel full.
Okay.
Yes, so that kind of thing.
So that means if your stomach is full, you don't want to eat too many things. You don't feel like eating more.
Yeah, you just do not feel like eating. Yes, yeah. Some of the new medicines, like the same class, of course, it just you just feel full. Your appetite, they work through the appetite center, that decreases the appetite. So these are very these medicines just does not work just one system, or it just works through your nervous system, your stomach, and everything, because everything is connected.
Right.
Like it's like cycle. When you have food in your stomach, it send the neurons to brain what to do next, kind of thing. So it's just like a very complex, function of food, appetite, hunger. There are different hormones which affects that. Then there is like whole your stomach, or the colon bacteria. Your whole GI tract has good bacteria. It's like a biome, like it's a whole environment there of the bacteria which process all these things. So, for example, if you take any kind of antibiotic, so it disrupts all the system.
Yeah.
That's why you should not randomly take antibiotic, because it just disrupts all the system. And then, in fact, there are bacteria which affects your hunger, your appetite, and it works through your neurons. They say that there are more neurons in your GI tract than your brain. So it's a
Wow.
whole system of neurons in your GI tract. When it's disrupted, then whole cycle is disrupted.
Because when you take the antibiotic, even the good bacteria goes. That
correct, yeah, because it just, of course, it destroys, kills
it
the
destroys
bacteria.
everything.
Yeah, it kills the good bacteria.
And then your system, your body also gets used to so much antibiotic all the time. Too much of it.
Yeah.
It
So
doesn't work anymore.
yeah, so that is because of using so much of the antibiotics. So
Yeah.
now, of course, unless it is absolute, necessary, you should not take antibiotics. Yeah.
Yeah, it's not good to take. People,
Because
people,
most of the things is like viral. I mean, of course, we know that if there is something like a strep or something which is bacterial and things like that, of course, you have to take antibiotic. But most of the things, like symptoms, cold, allergies, and these are mostly virus. So you should just not start it.
antibiotic. Some people just, they don't know the difference. They just take it.
Right, just that. Because usually the viral, usually it just gets better in 3 to 7 days. It will, even if you take, I mean, of course, antibiotic will not help anything. Of course, it's causing more problem. Whatever the virus is, it just takes its course to complete.
Yeah, I'm just gonna take one picture. I was thinking. So there's a lot of it's a very complex diabetes.
Yeah.
A lot of different things to know. Especially this different type of medication, because I was curious to know about this Trulicity and Ozempic, and then, but they say that also the saying for the diabetes that you should eat after every few hours. Now, if you're taking this medication, you're not hungry, because there's a thoda khate raho. Like my doctor keeps on telling me, you have to have I mean, she's a dietitian actually, so she says you take the meals and in between you have to eat also.
Some snacks, yes. Because some of them
I don't feel hungry. I don't feel hungry. I don't feel hungry to eat. I said, I don't feel like eating.
So that's why these medicines, of course, as a side, of course, side effect kind of thing. They just, with the research, learned that with controlling diabetes, it decrease. I mean, of course, if you have decreased appetite, you won't eat. Then, of course, you lose weight. That's why it's so popular for of course weight loss. So, but of course your body still need some nutrition. I know there can be drastic changes in the weight, but you cannot just go with this for a long time.
There's one person, my friend over here, she always comes here. Her name is Kamlesh. She's asking a question. She's saying, Dr. Iroom, I have a question. She takes Ozempic, and that makes her lose weight. She said she's losing weight, and she says she doesn't want to lose any more weight. So with the Ozempic, she lost she lost weight, and now she said that she doesn't want to lose any more weight. So how does she avoid doing that?
So I mean, of course, because this
most people want to lose weight, that's why, but
that's why because
she doesn't want to lose anymore.
Then I mean, of course, you have to see your doctor to see if you have to decrease the dose of the medicine, or you have to, I mean, of course, probably to just maintain your weight, then you have to see your nutrition thing too, because I know that it decreases the appetite. You just do not feel like eating, but then you still have to maintain your calories, right? That, I mean, of course, if you do not want to lose weight, then her scenario is different, because mostly people want to lose weight. So
I wish Kamlesh, I had that question. I wish I had that problem, but I don't.
Yes. So the dose.
Most people they want to lose. That's the thing. But some people, I guess there's enough for them, and then they don't want to lose any more weight. So she has to decrease the dosage. Okay,
sometimes decreasing the dose, but again, because we have to see that how her blood sugar is controlled. If the blood sugar, because if you decrease the dose, then maybe your blood sugar won't be, better controlled, kind of. Yes, but of course, these medicines in higher dose, we use it for weight loss. This is a weight loss medicine. So if you are not wanting to lose weight, then of course, other thing would be you have to maintain your calories or maybe change the medicine probably. Yeah.
I mean, this medicine, these Ozempic and especially Ozempic, I've heard a lot of people are taking it to, this is actually for, I mean, they're taking to lose weight, but this is actually for diabetics, people who are diabetic, for them to lose the weight. So regular people are taking it also to lose the weight. Now, is it?
So that is not the right thing to do.
Exactly. That's what I'm saying. That's not right to do.
Right. I mean, of course, this can be, because these medicines are meant for diabetes.
Yeah.
Then we saw that the results weight loss, you cannot just use it for, just weight loss kind of thing. So if you have, I mean, of course, it is affecting your blood sugar too. Then, of course, then you have to see that you have to maintain that much of calories, your blood sugars, that kind of thing.
Yeah, that's the thing. That's what I'm saying. So how can the doctors prescribe that for people just to lose the weight? That's what I was wondering.
Yes,
And then,
as I said, that sometimes, if you are overweight, many you can have just pre-diabetes kind of thing, high blood sugar. So they have to somehow, check on all those things. And as I said, that if you are overweight or obese, then most of the patients can have diabetes or pre-diabetes kind of thing.
I see. So this will work also for pre-diabetics, the Trulicity and Ozempic?
Pre-diabetes is, I mean, of course, it's just that it's a high blood sugar. So anything, of course, some of the as I said, that if you have pre-diabetes and if you have other conditions, like cardiovascular, history of heart attacks or coronary artery disease, your threshold for treating diabetes is low. Meaning, if there is a stroke or coronary artery disease, even if you are pre-diabetic or high blood sugar, you have to control it, because high blood sugar is, like it causes inflammation, so it causing more problems with the blood vessels. So yes, like for example, this medicine, if you have cardiovascular disease, like heart disease, this medicine is used in that condition too. Yes. So the medicine is not, it's not like one size fits all.
Right.
So some of the time, maybe other people who are like pre-diabetic or diabetes, their medicines can be different because they probably have history of a stroke or heart disease. So their medicines can be different, or they needed to be treated more aggressively than other who just have diabetes.
I see.
So your threshold, I mean, of course, that treatment or aggressive treatment is different. While when you are doing diet, it's like a universal kind of thing. You just have to do it for everything. And of course, we discussed many times that you do not have to do different diet for different diseases. If you have a clean, healthy, like whole food diet, it's good for diabetes, heart disease, stroke, everything. It's just one thing fits all kind of thing.
Right. That's true.
Mm.
I mean, I guess good diet and exercise, that helps in all kind of, any kind of, not only in diabetes, it can help in blood pressure.
Yeah.
And
of course, even if you are taking medicines, of course, sometimes the blood sugar is so high, or it's so, sometimes it's A1C is so high. Of course, diet, sometimes, of course, you have to start with a drastic change if you're just doing diet. But to control it quicker, then of course you have to have some medicines. But even with medicines, you have to be on some kind of clean diet. You can just add on medicines after medicines. And you cannot, once the diet is not right.
That's true. I have another question for you. This is from Shaliji. Does being overweight causes diabetes or eating a lot of sugar? I think the sugar thing is a myth, isn't it?
No, it's not a myth. I mean, of course,
And it's
if you eat more sugar.
not good to eat, but that's not the only reason that you get the diabetes.
So this is, again, it's something connected. Usually, if you are overweight or obese, you can have diabetes.
Right. That's what, but it's not due to eating too much sugar.
It can.
Can.
Yeah, yes. Because usually you probably need 1 teaspoon of, sugar, and usually average, like average people, they usually have 30 teaspoons of sugar every day.
30.
Whatever, yes, 30. Yeah, so whatever
Really?
you eat, it has sugar.
Right, right.
So, and sugar is not only if you're taking just regular sugar, all the
Right.
carbs converts to sugar. So many things it just converts to sugar. So if your body just need probably 1 teaspoon and you are doing 30 teaspoon, your body cannot handle because it has to get rid of extra sugar. So high sugar means that the pancreas has to produce more insulin to maintain that blood sugar. So where all this blood sugar is going, it has to go through liver, then it has to get rid out of your system. And as we said, that it's going every place, just to maintain the good blood sugar. So then it just, the whole system, then the insulin just starts to, and then a lot of production, then your body just gets resistant to insulin, then all this thing. And then of course, then overweight, obesity, everything is just kind of connected. So if you're eating more sugar, then you can, because you are producing a lot of insulin, and then the pancreas, of course, after producing that much of insulin for years, it just, tires out, and then there is no balance, and then you just become diabetic.
That is why they're saying, when I went to the dietitian, she said you have to read each and every, like behind any box or something, read all the ingredients, because sometimes they're hidden, you don't realize. Then, like you just said, it's not only drinking the sugar in the tea or something. It's
No, it's not only that, because it's just, we are seeing it, but
yeah, exactly.
you're taking like the calories, carbs, and whatever.
Of course, a lot of these fruits that we love to, they're saying fruit is good for you, but some fruits have very high in sugar, like mangoes and all that, right? Mangoes. So my dietitian, she said, well, you want to eat like mangoes? I said, yeah, but she said, take half. Don't take
But you could just have, because most of them, they have simple sugar. Then there is some simple, then complex and things like that, which body can handle and easily break down into, different products, then rather than all the complex carbs and things like that. So there are different kind of thing, but of course, it's many things which is sugar.
We have to eat the fruit, I know grapes has a lot of sugar. So what do you suggest is the best fruit to eat, like with it, not too much sugar? And I think
so basically, for diabetes, it says that if you have high fiber diet, you can improve your diabetes. Yes. So anything which is high fiber, because it works through, that the bacteria in your gut, they like fiber. So anything high fiber diet, it improves your gut bacteria. And as I said, all the things which is complex, it's like a whole brain inside there. So it works better when there is high fiber. So anything which is high fiber, you just have to see. And then of course, the animal products, animal food, it doesn't have fiber. So it's all the other things which has fiber.
It's in your gut for a longer time than the other foods.
So it's exactly that. And then of course it improves. So it just regulates all your appetite center and hunger and things like that. So fiber is, it's associated with low risk of diabetes. So if it's high fiber diet, then increased risk of diabetes.
I think apple has high, I think is high in fiber, I think.
Anything which, I mean, of course, which has with the peel, like it's
Right. Don't take the piece. Some people, I know some people in India used to take the thing offset. Thing is, don't do that.
Yeah.
When the kids should eat it, because they used to take it. Oh no, it's good for the. In India, I used to see them cutting it like, that's it. Don't over here. They don't. They said no. Take the way it is. So these are good, very good tips. I mean, we learned a lot, so much. Especially about the food and the medications, and they say the gut should always be clean. Then, if it's good, if it's clear, then that helps.
Yes. Yeah. So, of course, with all this research and things that, as I said, that there is a whole ecosystem in your gut. It's all balance, and it's just complex. Of course, there is still more research and things, but with the scientists, I mean, we have learned a lot in recent years that, I mean, it's a whole it's a whole different thing which is controlling your whole appetite, hunger system.
Wow. So medications play a big role. Before you read that, I guess again, it boils down to one thing, and exercise helps a lot. I mean, exercise.
Of course, because you lose extra fat. When you lose extra fat, and then it can. But for diabetes, the cornerstone, like if there is one thing you have to do, is of course it's the diet, and the physical activity or exercise. Of course, it always controls, maintain
the weight. I think weight also.
Yeah, it controls
the weight.
So basically, it won't just make you lose weight, but it controls or maintains the weight.
Shaliji is asking another question here. Is green tea good to clean the gut?
Yes, and green tea, it has, I mean, of course, it's like antioxidants. So it does. And I think we did one session where we were trying to see that which improves. And of course, all these antioxidants, anything which decreases the inflammation, like vitamin D, vitamin E, any food which contains that. This apple cider vinegar, it has good benefits. And
apple cider vinegar, right? They always keep on saying that you should take that, but
correct. So this is that it maintains or controls your blood sugar. So apple cider vinegar and those kind of things where like kimchi, so those are the things which is like an antioxidant, anti-inflammatory, because everything it starts with inflammation. Sugar, of course, causes inflammation. So once the inflammation starts, it's your whole body, it's any disease or disorder happens because of the inflammation. Your arteries and veins those arteries are inflamed, and it can cause a stroke, of course, heart attack, and inflamed like joints. So
it's a good thing then to take the green tea to clean the gut.
Yeah, green tea, of course, it has a lot of benefits.
So if you take one cup a day, is good?
I don't think that, I mean, of course, there is not like a set amount. I know that sometimes, if many culture, they drink it after each meal.
Every meal.
After each, some with that for the digestion, and then I think it's just good.
Now, when you go for that Japanese or Chinese, Thai food, they have the big kettle right next to you. I like to drink. I like the green tea a lot. I like it. I go there and I eat a lot of it. Oh, the Kamlesh is asking another question. Taking substitute for sugar, like Splenda, etc. How's that?
No, not good. Not good. So it is known that all these artificial sweeteners, it disrupts your microbiota, meaning that your microbiome, the bacteria in the gut, it disrupts it. Meaning whatever their circle balance is, many people who used, I think few years ago, they just made a big thing out of it that instead of sugar, do this alternative, but it's not good. So we have seen many patients who have problems with digestion because of that, because it came out that it just disrupts your, that the microbiome, your system in the gut.
Wow. So all this good to know, all these questions. Anything else anybody has? So
Maybe honey or something like that you can alternate, but for so it's if nothing, it's like no sugar.
but honey also has, a little bit.
Yeah, but I mean, of course, honey, we do not know that it is the real honey. There may be more additives. I mean, you never know kind of thing, right? So I know that there are certain ways you can see that if that's
The Shaliji is asking when you use the term inflammation, then what it is being referring to? Inflammation occurs when? Okay, when you eat the wrong thing or something, inflammation in the gut.
wrong thing or the sugar usually it causes inflammation. So wrong thing mean, of course, I mean, as we said that whole food, plant-based diet is the clean, it's a good diet.
That's the best diet. Plant-based diet is the
yes, yeah, plant-based. But if you are doing too much of sugar, it can cause inflammation. Inflammation meaning that there is a lining around your inside of your blood vessels. So when there is inflammation, what happens is like sugar, it works like there is some disruption going on the lining of the blood vessel. Your whole body tries to protect it, and it just produces many preventive or like a safe defense kind of thing, which comes around that, and it can cause like plaque and things like that. When it just grows and it becomes narrow, and you can have heart attack and stroke and all. So yes, so that is something, when you say that you have a very high inflammatory markers or very high inflammation, which can affect everything, even joints, your blood vessels, and things like that.
Oh boy, that's another thing. Plant-based food is the best. That's what
Whole food, yes, whole food, meaning that if you are eating an apple, so eat an apple like it is, not like applesauce or whatever the apple pie kind of thing. That is,
oh yeah,
it's still apple, but it's not the real apple. It's a real apple, like a whole food from how it was.
sugar is the as much as you can try to avoid, because we do get too much of it, in other food.
Without knowing, kind of thing.
Unknowingly we're taking. They put different names. Some people don't know what
So
it is.
any kind of O's, anything ends in O's, like glucose, acarbose, sucrose, everything, it's not good, huh?
Those are not good. Yeah, I usually read that, but sometimes. And even just quick question from my side, I like to drink coconut water. It's hydrating and it's good, but that also has some kind of sugar in it, right?
I don't think so.
So to drink that, because for hydration.
Sure if it has. I mean, of course, if you sometimes, when they have to package it, of course, they have to use preservative and things like that.
Right.
Just probably doing it just naturally when it comes out of that. I mean, of course, it's the best form, but anything which is packaged, they have to use preservative to prolong its shelf life and things like that. So then when it becomes, like problematic. But I know that coconut water, it has so much of minerals, and
yeah,
it's
very good. It's good for you to drink that. I mean, I like to drink that. Yeah, it's good. But like you said, the preservatives, you have to check what they put there is loaded with. They have all these names. We don't really know what they are. But I want to thank the audience here. Anybody else has any questions? I know Kamlesh ji and Shali ji, Ramaji asked a lot of questions. If anybody has any concern about diabetes and anything else, please do come and ask. And we're going to wrap up soon. So I want to thank so many of you who joined us today. Asha ji, Ramaji, Kamlesh ji, and Shali ji. Surjit came from India. Shashi ji, Amit Kaur was here. She's still here, maybe. And Nilima Sirvastava. And somebody, Vinod Goyal ji. Over here, Neelam Kapadia Patel, who's coming tonight. Dolly Kakwani, Devjani. This is also from Texas, I believe. And D. Herman, I'm fine. And this is somebody from India, I think, D. Herman. I'm doing good. You asked me that question, I'm fine. Of course, Shali ji to hai yahan par hamare saath. And Anil ji and Asha ji. Anil ji just joined. Sushma ji, Shashi Kapoor ji. I think he's also from, he's not in New York, but he's out of town. And yeah. So aap bhi dekh rahe ho. So I've seen everybody's names here. So I want to thank all of you for joining today. And it was such an informative session, Dr. Room. That was really wonderful. Aapne itna, all these questions you answered and explained to us so nicely. They're all very appreciative. Kamlesh ji, thank you so much for the great tips. Very helpful. So awesome, very awesome program. Love to be part of DGG. So beneficial to all public. Love you all. That's what she's saying. And Ramaji is saying the same thing. Great information. Same session. Yeah. Thank you so much, Ramaji and Kamlesh ji and Shali ji also. Thanks for the information. So Ab, you'll be back here in about 4 weeks. Every 4 weeks, you'll join us. And next time we'll bring a different topic. If you have any suggestions, anybody, you can always write to me or send me a note saying that talk about a certain subject, and I will inform that to Dr. Room, and then we can talk about that. And if you have any further questions about this session, please do ask, and I will forward the message. And the rest, everything is fine. Thank you so much for joining us and giving us all this information, Dr. Room, taking your precious time. I know you're off this week, so you want to enjoy yourself. You came back late from your show. She went to see Rahat. I'm dying to see him too. Let's hope I can get the tickets. So friends, join.
It was all full, sold out.
Yeah, I saw that. Some of the live thing that Dr. Sobia was doing, that live session. So thanks, friends, for joining. Have a wonderful day. And don't forget to join tonight. We have a very good program with Neelam Patel and her husband, Pradeep Patel, are coming tonight at 8:30 p.m. EST time. Please do join us. Thank you. And there's going to be a nice musical program tonight. Thank you very much. And see you back here on Wednesday. Of course, our very own Shali ji is coming with Subhash ji for another musical morning. That is morning time, this time, 10:30 a.m. We'll keep you posted. So thank you, everyone. Have a wonderful day. Thank you, Sushma ji. Thank you, doctor, for sharing this information. Have a great day. That's for you.
Yeah, thank you. Yes.
So thank you so much, everyone. Bye for now, and have a great day. Bye-bye. Just 1 minute. Okay.